do from A to Z. You cannot say you've got a quality management system if you don't have a policy statement, because that gives the direction for which the quality management system is addressing. And we've got key players in the quality management system, and particularly the quality manager. Who is a quality manager? This is the person who actually ensures that management system is followed through from beginning to end. So it's a very important responsibility. So in this, we are going to look at three things: the quality management system itself, in terms of how we can use it to do our jobs, looking at the quality policy statement, and also look at why we should have a quality manager in the whole process. So the purpose of the webinar is really to try to raise awareness among us on what really is involved with quality management systems. And I may stop here and ask a question of the team that is on board. How many of you do have a quality management system? I would just like to see by show of hands. I see nothing. Can I ask Nigeria, if you are from the NPPO, do you have the quality management system?
Okay, good afternoon.
Yes, good afternoon. Go ahead.
Yeah, so we have a quality management system in place, ISO 9001, 2015. Okay. And then we are frequently doing recertification to that. And I think recently we just got recertified to the standards, the quality standards. So all our systems and procedures are aligned with international best practices, and then our guidelines, principles are followed accordingly within the ISO standards. And so, but I'm not from the MPPO. I'm from NAFDAC.
NAFDAC, yes.
So my name is Abiola Tijani. So it's nice to meet you, sir.
Okay. Thank you for that response. Maybe I can ask, I've seen Liberia say they have a system. Botswana, maybe Botswana, can you tell us what is happening in your country? Do you have a quality management system? Botswana is not responding. Zimbabwe.
Good afternoon, Dr. Kedera. Sorry, I just joined. But I hope I got you well. We are to say if we have a quality management system, is that so?
Yes. That is what you have to say. Do you have a quality management system? Oh, she's gone off. So let's go on. So the second purpose of, go ahead.
And
yeah, good afternoon.
There is Louisa, talk first, then there's somebody with Samsung.
Yeah, so for us there are many gaps. I can't really say we have a working quality management system in our NPPO.
Okay. Thank you. There was somebody with Samsung phone. They have gone off.
Yeah, hello.
Hello, go ahead.
Yes, so I'm speaking from Liberia.
Mm-hmm.
And yes, in Liberia, we have a currency division here at the Ministry of Agriculture, and they are responsible for quality management system here at the Ministry of Agriculture. But the director for that department is part of this meeting. I think he could speak out how their division go about with the quality management system.
Okay. Thank you.
Director, are you there?
Yeah, Kabu is on. Hello?
Okay, please introduce yourself and tell the team how you take care of the quality management system here at the Ministry of Agriculture. Thank you.
Okay, thank you, Honorable Minister. Okay, Nyalwa Kapu is my name from the Plant and Animal Quarantine, MOA. For the quality management system, we are adapting the international standard, yeah, which has to do with the ISPM 12. And then through this, we actually utilize that system completely, where of course is ready here working for us.
Okay.
Which is the
Okay.
ISPM 12. ISPM 12 is what we adapt merely for phytosanitary procedures.
Okay, thank you.
Yeah.
So as part of the purpose of this webinar is really to make sure that as competent authorities, we know how to structure and effectively manage a quality management system where we have a quality policy and we have also identified a quality manager. And then we will also be looking at what steps can we take in terms of organizing and committing ourselves to a quality management system. This is the purpose of this webinar. As a start, when you talk about a quality management system, the first question you ask is, what does it really mean? And you can see the diagram that is there. You need to plan, you need to do what you've planned, you need to check the effectiveness of the plan, and then you need to act on where the gaps are in order to improve, such that the quality management system becomes a continuous improvement in terms of your performance. So you must make sure that if you've developed a quality management system, it is structured to enable you continuously plan. That is, you define your objectives and what you need to do. You need to implement what you've planned and execute it. You need to monitor whether you executed it as is planned or there were deviations in relationship to the policies and objectives, and then you take action in a continuous basis. And that is what quality management system is all about. It is actually aimed at assuring your stakeholders that you are doing things in line with what is expected of you. Now, in most of our competent authorities, we have got various factors. So as a competent authority, whether it's on food safety or plant health, you've got technology which you have to use. You've got persons or personnel who do the work. These people are a part of an organization. And lastly, there is the environment that you work in. And you can say it is, sometimes we call it POTE or POTE model, really referring to the people, the organization, the technology, and the environment. The interaction of all these factors can greatly influence the quality management system you have, or they can actually make the system or the competent authority very ineffective in what it does. For any organization, the people are the most important in anything that you do. For these people to function, they should be within an organization. For the organization to address the changing needs, there is technology. But we must never forget, we are working within a given environment. There are stakeholders and there are other legal issues that we have to deal with. So every time you reflect on this, the quality management system is not about technology. The quality management system is not about the environment. It is not about the organization. It's not about personnel. It's about the total sumness of what you do in everything from A to Z. And that's why we always call or refer to this. Now, please remember this as we go forward. You'll see where it becomes very important. Some of you have seen this picture, which relates to what COLLEAD uses to make assessment of whether the competent authority is working effectively or has gaps that need to be addressed. You know you are at a current situation, you need to move to an improved situation to the right. Looking at this, is your current situation okay? If it is not, how do you move to the improved situation? And what is going to determine that improved situation? You must first focus on a strategy or a strategic vision that will guide the process. As we've always been told, if you don't know where you're going, anywhere you go will be home, and that can become dangerous. So as a competent authority, you want to have an improved situation in terms of delivery on your mandate. And to deliver on your mandate, you've got 4 pillars that interrelate. You've got the governance system. This is looking at the laws, looking at the institutional arrangement, looking at the financing, looking at the operations of the organization, which are determined by the operational processes that are put in place based on the laws that have been enacted in any country. Now, these operational processes require some set of skills and competences in order to be able to deliver the desired results towards improved situation. And then you always have to ensure that you communicated and related very well with the stakeholders. So if there is no communication, it hampers the effectiveness of the competent authority, and you not move from the current situation that you want to improve. If the laws and regulations are not in line with what is expected for the improved situation, then you have to review them. If the operational processes are not aligned, then they need to be reviewed. And that's why we talk about the change management of the processes that you undertake as a competent authority towards the desired results. And through this, we have about 180 criteria that you can use to assess the competent authority capacities and identify the gaps. But overall on this, you always have to superimpose a quality management system, because without that system, it becomes difficult to function. So looking at the competent authorities and looking at the requirements, as one of you has indicated, international standards. And international standards in our context here can be referring to the ISPMs under the IPPC or under the Codex Alimentarius Commission. These standards are used in ensuring that as a competent authority, you have a credible and effective national control system. And to have a credible and effective national control system, it means you have systems that are transparent, that are understood by everybody, what you are doing across the spectrum of what your mandate is. You are expected to demonstrate effectiveness of the system. So you do not just say, I am using ISPM 12. How do you demonstrate that you are actually using ISPM 12 or ISPM 14? You must use these tools to strengthen stakeholder confidence with what you do. If the stakeholders are not confident with your results, what then becomes of you? It means you are not delivering on what is expected of you, and therefore you cannot facilitate trade. So when you look at the challenges of a quality management system, it means you are looking at how you can be effective, how you can demonstrate that effectiveness to build stakeholder confidence and eventually facilitate trade, whether it's at national level, it's at regional level, or at international level. Thus, the QMS becomes a strategic lever for all operational processes because it guarantees that you are doing everything right as is expected or as is defined within the laws or the regulations or as is provided within the standard operating procedures, that you have the skills to implement that you have communicated with the stakeholders, that the stakeholders have confidence in what you do, and therefore you become very effective in facilitating trade. Now, adopting a quality management system requires that you comply with international standards and at the same time look at what the national standards do require of you. If, for example, you look at ISPM 47, it provides for audit in plant health context. If you look at food safety, there is the Food Safety Control Systems Assessment Tool, which then gives you the guideline of what you must do. So as a competent authority, you have a system, and we've talked about the national control system. There are documented processes that you use. These documented processes need to be traceable. You need to monitor what you do at every level and determine where there are lapses, where you are not effective, and therefore improve on it, and it becomes a continuous process. That means the system needs to be dynamic in order for you to continually comply with the requirements. And you all know the requirements internationally keep changing. So as they change, you also need to be looking at your quality management system. Are you really in line or in tune to remain relevant? And therefore, to be effective or appropriate governance is critical. Who determines what happens within the competent authority? Competent authorities may be part of the larger Ministry of Agriculture. They may be independent units, but at the end of the day, the governance of what you do in line with international standards must assure that you are doing what is right at all stages. I will stop there. I don't know whether there are any questions for the time being.
I don't see any question in the chat, and I don't see any hand raised.
I can continue.
Proceed. Yes, thank you.
Now, I've just talked about governance. And you want to understand governance, it is about what laws govern a quality control, competent authority, what laws and regulations are in place to establish that competent authority, what is the financing arrangement for that competent authority, and then beyond that, you have got a quality management system. And lastly, how do you manage that quality management system? You must look at the mechanisms, the processes, the structures that are in place to manage the national control system. So if you are inspecting, you are doing risk assessment, you are doing the reporting, you are doing the analysis, you are doing whatever you do. Are these processes adequate to evaluate whether you are doing what is right based on a quality management system? Are these processes well documented? Remember, when you start talking about a quality management system, you would say if it is not documented, it does not exist. And if Kadera is doing a process, can David repeat the process in a consistent way and get to the desired results if it's the same thing? How do you align the organization strategy with the quality objectives that you've set for yourself? Do you have adequate resources, human, material, and financial, to plan, to do, to monitor, and act, that is, review what has been done? Because if those are not there, it becomes difficult to manage a quality management system. So everything becomes cyclic, and you have to take action at all stages. As one of you have said, ISO standards, and some of you are already aware of them, they provide a very good benchmark on how you set up a quality management system. And in many cases, you may require to go through training on ISO 9001 to superimpose it on what you're doing as a competent authority. And some of the competent authorities that are here are already certified based on ISO 9001 2015. So it is something that you have to look at. So don't just look at your food safety requirements. Don't just look at your plant health requirements. Look at also what is required to ensure that the service you provide in terms of a competent authority for food safety, in terms of a competent authority for plant health, are also in line with what is required to get substantive or quality results that build confidence among the stakeholders that you serve. And some question that you ask, what are the key factors to consider? For example, is the management committed? It's actually been a pleasure to understand that in Liberia, I think we had a comment that, thank you, Minister. The Minister is here and the NPPO is also here. So we can say there is commitment from the management to get things done. Now, of course, I'm not saying that just by their presence, they are committed, but it's a first show of commitment. The things that you look at, are they aligned, for example, with the national SPS policy or the national food safety policy or the national phytosanitary policy? We are using SPS to just reflect on the entirety of the competent authority. Is there a national policy? How do you align? In some countries, there may be no national policy, but there's the agriculture policy, which refers to SPS. So you need to make sure that you are aligned if you are to be effective. Have you put in place mechanisms to comply with international standards, whether they relate to food safety or plant health? And at the same time, yes?
No.
Is somebody called Balde talking?
No, I think it was a mistake.
It's a mistake, okay.
Yeah.
So you're looking at plant health, you're looking at food safety. Those are international standards that are there. But also in management systems, you also have the ISO 9000. So are you in compliance with those? Have you defined your quality objectives? Are the stakeholders involved? Talking to one organization, they told me our quality objective cannot be determined by the stakeholders. But then the question is, how would you measure success? How will you build confidence if the stakeholders are not involved? So it is very critical that you involve the stakeholders. Remember the last pillar I talked about for a competent authority, communication and relationship dynamics. Involving the stakeholders helps you address many of the issues that are designed towards ensuring quality service provision. How are you implementing the activities, and what structures do you have to monitor whether you are on the right track or on the wrong track, or what are the desired changes? And also, how do you track the changes that are necessary in line with the international standards? And then, what structures have you put in place for continuous improvement? That means that anything that you put in place is not fixed in stone. You have to always look at it, whether it is addressing the needs. You developed that last year, and now it is 9 months afterwards. Is it still good, or you need improvement? So you need to have a process for continuous monitoring and continuous improvement. Drawing up the quality policy statement. First, number one, what you need is a clear quality policy. And I'll be getting back to that. To have a clear quality policy, there then must be allocation of resources, which promotes the culture of continuous improvement. So the management commitment will always be demonstrated by the quality policy that is in place, the resources that are allocated towards implementing that policy, and also at the same time facilitate continuous improvement of what is in place. The second thing is you need the policy statement to be in alignment with the national SPS policy. Like I've said, you might not have a national SPS policy, but you have got a national agriculture policy, which refers to SPS, or you have got a standalone phytosanitary policy, or you have a standalone food safety policy. So the policy statement that you have in terms of a QMS must be in line with that policy that you have either as SPS policy, food safety policy, or phytosanitary policy. And through this, you should always reflect, if you've got a policy, what does the vision statement read? And what are the objectives? Because you need to make sure that the quality management statement you come up, quality policy statement you come up with is aligned to the vision that is stated in the national SPS policy. And it needs also to integrate what the national strategic priorities are, whether it is strengthening the SPS governance, improving communication, improving skills, improving the operational process. These things need to be integrated into the quality management, quality policy statement. Compliance with international standards. I've talked about this before, whether it is Codex or it is IPPC. These are always very critical things. You need to look at the ISPMs, what they do provide, and also look at the national standards. What do they say? Because in some countries, national standards have been developed, and therefore you need to be reflecting on it as you develop a national quality management policy. You need to define the objectives, which must be measurable and relevant to your situation. And it must have regular monitoring and assessment. Do not go to the literature or to Google and copy that policy objective of US and hope it will work in Uganda. Or copy that one of Uganda and hope that it will work for Zimbabwe. You need to really look at how it relates to you. It needs to be relevant. At the same time, the objectives must be able, you must be able to measure the results or what you are doing with those objectives as you implement your activities. Involvement of stakeholders. It is always important to involve stakeholders. The service users, other government, service users, I mean, the end users of the services you provide as a competent authority. You also need to involve other departments of government in what you do. You may also involve even the recipients of the products from your country. So you clearly must identify the stakeholders and therefore establish effective, collaborative communication and coordination with them, because that will help a great deal in drawing up of the policy. You need to draw up a detailed action plan for implementation. You need to provide for training. You need to create awareness. And you need to undertake regular internal audits, which is actually aimed at monitoring what you are doing at all times. And lastly, continuous improvement. I'll continue singing about this. Continuous improvement. Plan, do, check. It is a very important thing. What did you plan? That you have implemented it. Does it work? No. If it doesn't work, what are the gaps? You need to close those gaps and then keep recycling the process. And then finally, as you've developed the policy, you need to go through a process of periodic review, whether it is the right one to continue with, or there has been a change requiring you to change it, and therefore continue the process of improvement. Now, here we've got a case, for example, of the Gabonese Food Safety Agency, the quality policy. I don't know whether you've got somebody from Ghana, from Gabon. You can see they put up the policy statement saying AGASA is committed to a quality approach aimed at guaranteeing food safety and effectively meeting the expectation of national and international stakeholders. You can see the involvement of all the stakeholders. This policy is part of a quality management system aligned with ISO 9001:2015 and ISO 1720:2012 standards. This is a very objective approach to developing a quality policy statement. Now you can see they have actually put up 10 objectives. You don't have to have 10. They range from the organization and management processes, continue to monitor, improve analytical performance, innovative analytical methods, welcoming customers, working closely with the specifiers, dealing with emergency situations, evaluating technical equipment, developing skills, and laboratory accreditation. I would like to stop here and we hear feedback from some of the participants. Beatrice, just before I go on.
Just Shagema, we have a question from Varni Kamara. Maybe Varni can open you can open your mic and ask your question. Varni?
Yeah, good morning. I'm Dr. Van M. Kamara, the director of the Central Vet Lab, Liberia, Ministry of Agriculture, Liberia. So initially, when I introduced myself, I said we have a quality manual, we have a quality management system that has been validated. Looking at the aspect of phytosanitary and other sectors within that require quality management system, is it possible for us to have a single quality policy document that can serve as a national framework to harmonize all the quality management across various sectors in a country? Is it possible? Over.
Yes, it is possible, and it is always the desired way because then you approach it collectively. Because you look at it from the SPS perspective, from plant health to food safety. Like we always say, when does an orange become food? When it is in the farm, it is food safety. When it is planted, it's plant health issue. When you apply pesticide on it, MRL issue, it is a food safety issue. So if you approach it collectively, then it is much easier. So if you have got that collective quality policy statement, it is much easier. But we know what happens in our countries.
Yes, in the case we look at different ISO, like the veterinary lab look at ISO 17025, there's ISO 9000, there are different ISO. And in addition to that, every quality manual has a quality policy, a statement. So which might slightly, differ from other, sectors. So I was just looking at the possibility that we could, because if you develop in a framework, you need a quality policy, a quality statement. So what would that statement be? Over.
The quality statement would require you to have stakeholders from both the plant health, veterinary, to sit together and interrogate the system, looking at the current situation in order to design it. And like I've said, I am not going to sit here and tell you this is the best one, or are you going to copy what has been done for Ghana, or copy what has been done for Nigeria. No, you need to have that interrogation and internalize the whole aspect before you come up with the policy statement. So you look at the quality policy statement because you look at what is happening within your country, and you can look at the various ISOs. You see ISO 1720, which is on inspection, ISO 1725, which is on analytical capacity, ISO 9000, which is on management, looking at the entire thing. You can look at those things and come up with what you consider as your quality policy statement. You look at the one I've shared from Gabon is actually combining two, ISO 9001 and ISO 1720 in terms of what they're doing. So it is possible this can be done, but it requires a lot of consultation between the various competent authorities and the stakeholders to guide the process. Okay, Beatrice, I wanted you to make a comment on the policy statement. Beatrice Atieno. Can unmute yourself?
Yes. Yes, I've unmuted.
Go ahead.
You wanted me to do what?
Make a comment on the quality policy statement.
Correct. Thank you so much. The beauty of what you've just said is exactly what the standard, if you look at the standard for ISO 9001 states, that when you're coming up with your quality policy statement or your commitment with regard to quality, it's very important that you consult with the stakeholders and get to know exactly. The other also important thing is to understand your organization. And so they say that before you come up with your policy statement, you must be able to ensure that you have done what we call the organization context. You know exactly what you are there to do, what kind of services you're carrying out, and all that. So that with that consultation with the stakeholders and all the products that you're carrying for producing or services you're offering, you're able to come up with a holistic policy that will be able to ensure that your services meet the customer requirements, and especially for competent authorities, that the services we offer are able to ensure that the organizations that work under the authority are actually supported and they're able to export, for example, or produce safe products, or if it is a laboratory, they are carrying out the right kind of measurements, they are carrying out or analysis. So consultation is key, one, and two, also, which has also been mentioned, is that we also must ensure that we understand the strategic direction that the organization is going, and that is to do with understanding the organization as well. So that your policy is not devoid of the mandate of your organization and what activities you're carrying out. Just to add on that. So I don't know whether there's anything else I need to add, but the 2 points already mentioned them, that we need to do consultation with stakeholders, and also we make sure that it is aligned with the organization's strategy. Yeah.
Okay, thank you. There is a comment in the chat on number 10. Is it a policy statement? What is indicated? Now, we are not here to critique. This is what you have to really look at to ensure that it is a real policy statement that you indicate. Let's not, this was just an example of what has been given out. So we are not here to critique what it is, but you will need to evaluate within your country, within your situation, what then should constitute part of the policy statement. I would request...
I can add something on that, Dr. Kedera. The one that I saw you projected already within it, it had quality objectives. But again, depending on the mandate of the organization, they could decide to have the objectives separate as their self, as are documented elsewhere, not within the policy, because it sometimes makes the policy so big and not really user-friendly. So if you are able to separate the objectives, that is also be okay. Yeah, this particular one.
Okay, thanks. The question that has been raised for the benefit of those who are there, there's quality policy objective, working towards a laboratory accreditation. The question is this an objective or not? And the person raising the question would like to understand. I would like to hear your views. Nobody is ready to... No, don't comment, Beatrice. I want to hear from there. Maybe I ask Brenda Kisingiri from Uganda.
Okay.
Hi, let me come.
Okay, thank you.
Could you, Shagema, I think that Gambia was asking if you could repeat the question, right, Mr. Lamin?
The question was, I think it was raised by from Nigeria. The point number 10 is about working towards laboratory accreditation. Is that an objective or not? And he's asking not because of criticizing, but he would like to understand how you would come up with an objective like working towards accreditation. That is the question.
Yes, Dr. Kedera.
Yes.
It is a very good, according to me, it is a very good objective. It is a major objective under which you can have specific objectives. That is my opinion.
Can I speak to that?
Yes.
So from the laboratory standpoint, the essence of the entire quality management system is towards accreditation. So, I mean, that's the benefit. So if you have a strong quality management system, then you become accredited. Because in the process of accrediting a lab, for example, you have to go through all those processes. You need to have a very good quality management system. Over.
Thank you.
Shagema,
yes, go ahead.
we had a hand raised from Gabo Bonwe Sejong. Sorry if I mispronounce your name. If you have a question, you can open your mic.
Yes, thank you very much.
Where are you from? Could you present
I'm from Botswana. Okay. I'm from Botswana.
Welcome.
Yes. Mine is just an observation or a comment. You know, there was a report by USDA, United States Department of Agriculture, that the SADC countries, they are least represented in codex committees. They only participate in 2 or 3 committees out of the 15 committees that are there. So I'm not sure if, is it the same for the West Africa or East Africa? Is this the same? Do you participate fully in those? Because I believe they are important for us we can get the opportunity to improve on the food safety issues.
Okay, thank you. Just hold on.
Then here in Botswana, our focal point is Ministry of Health. So my suggestion is that we need to alternate. We need to have alternate representative from both Ministry of Health and Ministry of Agriculture, because some of these committees, like the pesticides residues in food, are specific to agriculture, but we don't have representative in China, where they are the host. Thank you.
Yes, your point is very well noted. We are going to come back to it. I want to finish the initial point. From Nigeria, are you satisfied with the answers? Before I ask Beatrice to comment.
I wanted to make a comment about that too.
Okay, go ahead.
Okay. So in terms, the question is if it's a policy statement, and I believe sanitary.
It is an objective towards the policy.
Yes.
Objective, yes.
Yes. So food safety issues are evolving. Phytosanitary issues are issues that are evolving. If you look at 10 years, 20 years ago, the issues countries were dealing with at the phytosanitary level and food safety level have sort of evolved over the years. So I believe countries should always push for, because accreditation, I believe, is continuous. You may have a certain level of accreditation that deals with certain issues at this level, But moving forward, there may be new pests, new pesticide issues, and then you always need to ensure that you have the capacity, your labs are well accredited to deal with these issues as they emerge. So I think it's something that is valid and should be a well-noted objective. Over.
Okay, thank you. Beatrice, can you close on that? Beatrice Atieno?
Yeah, mine would be yes and no. Going with the comment I got from my brother from Nigeria, I think the main goal of all this quality management system is basically to get either certification or accreditation, so that then that would not really fit well as a quality objective, because that is ultimately your goal. But it can also still be an objective in the sense that you want it to sit there as an objective you set for a specific time within which you want to get that accreditation or certification. And that helps you then to come up with specific activities, work plan on what you're going to do and within which period and by who, using which resources, so that you can be able to achieve your accreditation. So yes, if you really want to work on that as a goal or as an objective and achieve it, so that you are able to set up what is your work plan and the resources and who is going to do what. But otherwise, because that is the main goal of the entire quality management system, as we've discussed, then it may not really sit well within among the objectives that you want to achieve. Because when you achieve all many other objectives that you set out, it's more or less like you're achieving that particular number 10. So depending on where you're seated, yes, it can be an objective, but by and large, probably if you leave it out and you do all the other objectives that are really relevant to your operations, it still would fit well.
Thank you, Beatrice.
Yes.
Go ahead.
The other comment was on the person who asked about the codex representation in the SADC region and so on. I would just say what we do in Kenya. In Kenya, what we've done is we have a focal point. We can call it the codex desk within the country, which lies within the standards body. And that desk is having many members, which is the Ministry of Health, Ministry of Agriculture, the County Council, Public Health County Council, and all the others that are relevant. And they sit, including the other competent authorities that have to do with like plant health and others, are members of that committee. And so whenever we have any work within Codex, they have a meeting within the country and they are able to come up with the national position. That when now there's a meeting, for example, in China or Argentina, whatever place it is, depending on what topic it is, there are representation from the most relevant competent authorities within the country that go to represent Kenya in that particular meeting, and also airs our concerns or what is it that we want to be included in that codex document that is being discussed at any given time, so that it is not left for only Ministry of Health or only Ministry of Health, Agriculture and so on. It is a concerted effort that we normally carry out in Kenya. Yeah, we work as a team.
Okay, thank you. So the question that came from Nigeria was about whether number 10 is a policy statement or whatever. It is an objective based on what Gabon has, so it's not a big deal. And as Beatrice has explained, it really reflects what you worked with your stakeholders and you've come up with as a recommendation of what must be done. There is a question that has come up: can a single quality policy document serve as a national framework? Yes, it is possible. The issue is, can you get the stakeholders together to agree on what is required? And because of the way our institutions were set up, we've ended up sometimes in fragmentation, and sometimes it becomes tedious, and therefore you end up with people working differently. But it is possible that can be done. The issue about fragmentation and representation, I think that has properly been addressed. There was a question where the local laws, and that is from Liberia, the local laws and the international standards alignment has some challenges. How does this program aim to address the problem? We are not addressing at aligning national law, local laws, and international standards. The issue we are talking about is having a quality policy statement and a quality management system, which we say in most cases is based on international best practices. So that is what you have to look at. And if you are trading, you're exporting products, you're doing whatever you do, you apply international standards. And therefore that behoves on you to try to align. We understand it takes forever to review our regulations and our laws. But in terms of standards and the rest, I think many of you in this call have actually signed up to the IPPC or to Codex. And therefore you kind of have an obligation to apply the standards and looking at what the WTO does provide. So that is how you would look at the whole point, looking at the international best practices when you're looking at what the quality management policy could look like. And from Suriname, is it in order to have a QMS based on quality standard like ISO 9001, 19001? Is it 19,000 or 9,000? Yes, it is actually a very good baseline to start from. Because what are the quality statements, quality policy, quality management systems are there? ISO does provide the guide, so you can actually base it on the ISO 9001, and you build up from there.
Actually,
Thank you. I can go back.
Yeah.
Yes.
For it to be a holistic management system, we would heavily advise like they go or apply the requirements of that standard he has mentioned, 9001. And if he was going to say 19011, that is the one for auditing, how you are going to check yourself. Because in quality management, we always say that you plan what you want to do it the way you planned it, check yourself. Now, the checking is also guided by a standard, which we are calling 19011. So I don't know that that is what the person from Suriname wanted to talk about. But yes, we should, as Dr. Federa says, we should base our quality management system on international best practices, and the ISO 9000 standard design, which gives us that.
There's somebody who has said we should start thinking about QMS beyond national focus and start thinking about regional. Yes, it is the way to go. But as you've rightly put, harmonization still remains our biggest problem. Equivalence still remains our biggest problem. Generating data, personnel remain. Remember what I said about our organization? POTE, people, organizations, technology, and environment. How can we relate within the region? It is possible, for example, the ECOWAS region can actually have a QMS for competent authorities. It is possible that the SADC could have, it is EAC could have, COMESA could have. The issue is how do you domesticate them at your operational level at national level? And that remains our biggest challenge. Can we start thinking widely beyond our own national borders and accommodate things that can actually be done at regional level? There is value in going regional, but you first of all have to break the national barriers. That is always a big challenge. Okay, thank you for the discussions. I think we can pick it up from there. Sorry, my slides are not moving. Okay, so we talked about a quality manager. We have talked about you need to have a QMS. And for the QMS, you need commitment. But then who drives the QMS? And that's why we have a quality manager. And the tasks for the quality manager is to ensure the implementation, maintenance, and continuous improvement of the QMS, and ensuring the QMS complies with national and international requirements, Codex, IPPC, and like we said, ISO. One of the big tasks here is you are the quality manager in the competent authority, and you go and report to your immediate boss, who is the head of the competent authority, that what we are doing is not in line with QMS. Would you be having the job the next day, or what happens? And this is why we talk about the need for commitment by the top management of the competent authority. And that's why we invited you, because you needed to accept that this is a process that is important for the competent authority, and this is what needs to be done. And therefore, when you are appointing the quality manager, you need to look at all these things such that as they do their tasks and report to you, you are also in sync. So the tasks that the quality manager would have to the competent authority is managing the definition and application of the QMS. What does it mean? In every organization, as we are going to learn later, there is a culture. There is reporting hierarchy. You introduce a quality manager. It distorts the reporting culture. What do you do? So it is a very important task. And therefore, as competent authorities, when it comes to appointing a quality manager, you really need to really look at the issues within your organization such that the quality manager you put in place is going to be effective in the roles. As indicated here, managing the definition, ensuring compliance with the regulations and the standards. He's kind of a prefect of the entire system. Coordinate the internal audits and management reviews, training and raising awareness among the teams. So supervising document management. This is a nightmare. The document flows, what needs to be done. Remember, you will be shifting people from their known culture. They don't record everything they do. They know everybody knows. Now you're going to require that they record everything they do. Promoting a quality culture means shifting people's way of thinking and then facilitating external assessments and audits. And in some cases, quality managers have been appointed, and they sometimes are accused of running parallel systems. And this is what we are talking about, the need to avoid this by having commitment to the process. Because if it is not understood from the word go, then it becomes a problem. You may be asked as a quality manager, who gave you the authority to question my decisions? But it is a process that is required. You did not sign that sort of thing. So it is something that is very, very, very important. And we say the main activities of a quality manager is to assist the management in drawing up the quality policy and ensuring its operational implementation. That's why I say do not copy-paste a quality policy from somewhere, because when it comes to operational implementation, it may give you problems. Updating the QMS procedures and tools, internal audits, internal training, and then the quality manager also needs to keep abreast of SPS regulations. This is both nationally and internationally. And internationally, we're talking about ISPMs and what is provided under Codex. Why is this important? Because this also informs the required reviews to the quality management documents or procedures. And we also need to ensure that the documents and the data is traceable, because if it is not, it will then present a problem. So the quality manager then becomes very essential in a quality management system. So in a nutshell, documentation, the policy and the procedures, they need to be documented, they need to be understood, they need to be religiously followed on by all within the competent authority. It becomes the Bible of the organization. That means when you are drawing up the procedures, you have to look at this is what is provided for under the international standards. This is what the national laws and regulations do provide, and this is how we are going to implement them. So that is an important thing. The other element is, as you draw up these procedures, you need to be thinking about internal audits. That is, looking at what is being implemented. Is it as per procedure, or there are deviations that require corrective actions? You need to ensure training and awareness by the entire system. The ISO 9000, ISO 17020 or ISO 17025 may apply to the inspectors and the laboratories. But when you talk about a quality management system, it is across, from procurement, hiring, firing, administration, those procedures. So you need everybody to know. Performance monitoring, and then, of course, external relationship. Because if you come up with a quality management system, it requires to go to audits and to make sure that everything is in line. And then, of course, there is what we call international partnership. So in a nutshell, the quality manager supports management to ensure that it complies with all the requirements of a quality management system. And he or she would also help in mobilizing teams to ensure that the needed corrective actions are put in place, thereby driving continuous improvement of the system. Now, we've talked about what the quality management system is all about, what the quality manager does, and then the culture. I'm sure in all your organizations, you have got your culture. I hope this figure here looks familiar. To change people takes time. You need to create understanding. So you must create awareness. And you need to go beyond awareness and create ownership of the process if you really want to be successful. So the first question is, as a competent authority, what is your strategic direction? What are the procedures in place? First of all, what is the structure that is in place? What procedures are in place? And then what is the organizational culture? After understanding this, you need now to superimpose the QMS on top of this. The strategic direction remains the same. But once we introduce QMS, what does that do to the structure of the competent authority? What does it do to the procedures you currently are undertaking? What does it mean to the culture that has been adopted over time? You may need to do nothing, as it is based on a QMS system, or you may need to have a complete overhaul. That means you review the entire process that is undertaken. And you know, change is always not easily accepted. So it is a tough task that must be addressed from the onset. And that's why we talk about commitment by the management of the competent authority. To manage change, you need to have a clear vision. Incorporate QMS in the process. The organization that is the competent authority may already be having a vision. How do you inculcate QMS into that vision? Which teams do you need to mobilize around the quality objectives that are defined by the policy that has been created? How do you communicate to avoid resistance or to overcome resistance? Resistance will be there, so you need to come up with mechanisms to actually overcome it. How do you manage transition through awareness, through training and support. And how do you consolidate success to embed good practice? It does not work overnight. It is a process and therefore calls for investments. So we look at competent authorities based on this small brief. You need to understand what you need to do and then follow it up how to do it. Don't start with how to do it. You need to first of all define what to do. What is the vision of the competent authority? What systems are in place right now? You are bringing in a QMS. What modifications do you require? That will define what to do. And then you go to the next stage of how to do it. So, points that you must remember is number one, management commitment. And I'm talking about top management commitment. There must be a clear vision to guide the quality management system. You must mobilize teams around the quality objectives that you've set based on the quality policy statement. You must actively communicate in order to overcome resistance. Supporting through training is always an important thing, and you must embed it as a good practice. I'll give you an example of what I had to do, and I know some of the people I worked with are on the call. When we introduced this in one of the organizations I was in, there was initial resistance. And I had actually two. Point number one, attaching to the payslip, the organization objectives and the policy so that everybody understood, including the vision. And I had to say, when I meet you in the corridors, I would ask you, what is the vision of the organization? What is the mission? The next thing was the quality policy statement. Sharing it out and asking anybody on the corridors, or if you are calling, you ask. That was to make sure that you actively communicate to overcome the resistance. And therefore, you really need a structured approach. And I would say, as the heads of competent authorities, you will have the bigger task of actually championing a quality management system if you really want the quality manager to be successful. And that is what would enable continuous improvement. So for this, we had this introductory seminar. We are going to have the collective training starting towards the mid of July. And this is where we talked about the need for the countries that are present. You need to start thinking about what would be your quality policy statement. And we will have somebody who may assist you to work with you towards drafting a quality policy statement. You need to nominate the two people who will attend the training. And at the same time, start thinking about in your organization, who would be a quality manager and who would be a deputy. This is information that would require to get from you before 30th, because in 30th of June, 2025, because we hope to start this training from mid-July. And then, of course, after this training, we will follow it up with the post-training support to help you build the system. And with that, I would like to stop there and ask if there are any questions. Thank you very much for listening.
Victor from Nigeria raised his hands. Victor, please.
Victor?
You see anything? I don't know that.
All right, Kedera, thank you so much for the well-detailed presentation. So my question, I have like three questions. So you had mentioned the ARSA tool as one of the tools for sort of like conducting the gap assessment or a gap analysis, but you also mentioned a few other things that because I see the ARSA tool more like evaluating the phytosanitary, the sanitary and phytosanitary strength, But are there other tools or other frameworks that can be able to assess gaps and where the competent authorities need to channel and focus their eyes on to develop so as to have a quality management system in place beyond the RSAT? That's one. Then number two, is it also possible to begin to think of a scoring system for competent authorities in terms of QMS? Because you had mentioned that there's a bit of, I mean, we that are attending this training, for example, we understand the importance, but sometimes there may be a disconnect between telling the management and saying, "Oh, this process is actually not in line with best practices, especially uh, considering the ideals of a QMS." But having a scoring system that sort of ranks competent authorities may begin to put those at the management on their toes. And I say this, for example, with the concept of the ease of doing business. I don't know if you know about that. A lot of countries who ranked low began to put in so much work to see how they could rank higher on that scale. So is this something that we could possibly be thinking about in the future? And my last question is, what is the difference between the QMS and the internal auditing process? It's a bit confusing. Which one comes first? Is it the QMS before the internal auditing system, or does the internal auditing system come before the QMS? Thank you. Over.
I'll start with the last one. The QMS comes first. And internal audit, internal audit, you can apply it to several, it can be several things that you can apply it. You can do auditing regarding QMS. You can do auditing regarding the implementation, inspection operations. You can do auditing regarding laboratory analysis. So for QMS, in QMS, the audit comes after you put the QMS in place. RSAT, as we've always said, RSAT stands for what we call a rapid SPS assessment tool. It's just one of the things that we are out there. And we developed it as a rapid check of assessment. But there are dedicated tools, like for phytosanitary systems, there's the PCE, phytosanitary capacity evaluation, which goes through a more comprehensive way of assessing where the gaps are. And through it, you develop a strategic plan, and then you can decide on what you need to do. Then there is also the food assessment tool, which is there for if you're looking at food safety systems. So all these tools are there. The issue is when you start thinking about a QMS, you will have to look at, as Beatrice did say, look at what is provided under ISO 9000. And then you start looking at what you put in the system and whether it aligns with the requirement for a QMS system. And that's why we talk about looking at ISPM. For example, if you look at ISPM 47, somebody mentioned ISPM 12, looking at the various processes that you have in place, and then you move on to the system. So there are all these things that are out there. So it depends on where you are, what is your current circumstance, and what you really need to get going. Currently, of course, under ISO 9000, it will look at the entire spectrum of what you are doing as an organization: administration, supply, hiring, analytical work, inspection, and the rest. That's how the QMS is currently structured. So to look at the entire end, that means it's going beyond just the technical ability to provide service. So it is important that you understand your situation and look at what is provided under the ISO 9001:2015. Regarding the scoring system, as Khalid and as ourselves, we've shied away from doing any score because when you do scoring, what am I reporting and for what? We actually see you as countries wanting to do what is right for you. For example, if a SADC develops something, or ECOWAS or COMESA, and that's what they want to use to rank, up to them. But for us, we've tried to avoid, we provide general information in terms of this is what is required to get things going. Of course, like you said, talking to the management sometimes takes a long while. We organize these meetings and we say, we encourage the heads, the directors to come so that we can share the information. We know Lagos was not built in a day, even Abuja was not built. It takes time. And it is for us to start improving on our communication such that some of this information can get to our superiors, that they understand this is where we are coming from and what the benefits are. It is not just a procedure being done in isolation. So it would be important that you actually look at how you actually organize yourselves to ensure that you get to the desired results. Remember, you are a part of a part player in the global league. If you are a part player in the global league, it means you have to raise your standards to where everybody else is. Do not expect the other countries to lower their standards to join you where you are. Now, we know there are challenges, but I believe slowly, the challenges can be overcome. That's why I'm saying Abuja was not built in a day. Nairobi was not built. You have to start putting in systems slowly by slowly. And that's why we are saying we're going to go through this training. Some may move very quickly and have the systems in place. Some will need time before it is properly structured and its function. That was the question from Victor. I don't know whether there's another question.
Yes, from Dalton. Dalton, can you open your mic and introduce yourself? And then we will have another question from Botswana.
Good morning, all. Good morning. Good afternoon, wherever you are. Dalton Hastings from Jamaica, representing the National Plant Protection Organization, Plant Quarantine. I just want to share our experience with you in terms of Jamaica perspective. We have been accredited ISO 17020 past 3 years. Just wanted to say it was not an easy task, but the benefit to be accrued from accreditation is manifold. And I just want to say to us in this group that is something that we need to engage on. I just want to reiterate some point that the speaker have said, commitment from top management. That is one of the foremost that we had to do from Jamaica. We had to ensure that our directors, our chief, everybody lead from the front. And what that means, commitment does not just mean that you say, yes, I have signed something. It means that you have to be committed to provide the resource, provide the training. Because one of the things you have to understand is that you, as somebody said, you have to do a gap analysis. Look at where you are and where you are going. So you have to be sure that you have the requisite resource and you're committed to provide it. You have to ensure that you have inclusiveness from all. That means your staff at every level, because it can't be something you just give a person a document and expect them to implement it. They have to know why is it that they are doing it? How is it that I'm going to do it? And what is it I'm going to do? So you have to ensure that all then you have to ensure that your stakeholders are involved. They are the one who are going to be coming to you to use your system. And if they are not aware of what you are doing, they are not aware of your quality management, why is it they are doing it? It's going to fail. So they too have to be involved. And one of the things I want to emphasize that a quality management system does not tell you what to do. So if you're going to be accredited in ISO 17020, my apology, we have been accredited in ISO 17020 for our inspection body, globally certified by our institution. So one of the things I want to say is not that your quality management system will tell you what to do. A lot of time people are fearful because you think that somebody going to come and tell you what to do. All the system, all the quality management will say to your standards, are you doing it according to how you say you are going to do it? If you are saying you're doing ISPM 15, all they're going to say, I am going to grade you according to ISPM 15. So you must ensure that you develop clear procedure. And the procedure that you're developing must include all your staff members. So they know how it is. So when they're audited, they know what to say and how to do. That's all that you have to ensure that to do. And ensure that whatever we do, we have clear procedure. The question was asked about internal audit. Internal audit is a part of the QMS system. So anything that you're accredited in, you have to do at least by minimum annual auditing, just to say that it is how it is being done. It's according to my procedure. So you have to do your internal audit. So whenever external audit comes around, you are not caught off guard. So I'm just saying to you, let us just employ on you. It's a very good system. It actually puts you above board. Not that because you're regulators, you are saying, I have to do this. You are doing it according to a global standard. So I just want to implore us just to continue along this part. Thank you very much.
Dalton, thank you, and well started. I can't add more. There was Botswana.
There was a question from Botswana regarding the choice of the participants since the C3 quality management system, one at inspection level, one at certification, and the third one at laboratory testing. And also how they can integrate, how to approach it.
We will ask them to give us a proposal before 30th, then we will follow it up.
Mm-hmm.
Yeah.
Okay. Then
there was from Zambia, Justina, I saw you indicated, yes, PVS have not referred very much to animal health in terms of the assessments. There is a PVS, which is a tool that's applicable for animal health. Thank you, Justina. Any other question that you've seen us?
there is a question from Nigeria, I think also, Dr. Shakiru Kazim. Let me see. Can a section or department within an organization initiate a QMS? Maybe Mr. Kazim, Dr. Kazim, maybe if you want to ask your question.
Okay, thank you very much for the opportunity. Thank you for the presentation, and thank you for the help. Listen, why I asked that question is this. Like what you already said, sometimes it's difficult to get your superior or the superior director to be involved in such training, or to have interest in listening. So I was thinking that, okay, if, for example, I'm the head of a session or a department, can I initiate the QMS myself and start doing it, and then see for them to now see that, okay, this is workable, this can be done. So from there, it cannot be scaled to other session or department within the organization, and eventually the organization will also have the QMS. So that's my thinking. Then the second one is on my second question is on if we can have, apart from what you have just stated on training specifically, is there another link or support that probably a contact person that when you are trying to implement it, you can have somebody to guide you on the way? Thank you.
Yeah, for the second part, this is the first time we're offering the training, and after the experience we learned through, I am certain that my colleague David is also thinking about developing an online training that can be followed. David, do you have a comment?
Thank you very much, Dr. Terry. That's great. We're already working on, and of course, a collective training. It's going to be a digital training. And that will be the second phase of this. It will follow this webinar, by the way. And what I'm trying to do in that training is to consolidate I'm taking notes from some of your comments to bring all the comments together and to be able to drive the message home properly. And then that's going to be a tutor training accompanied by trainer. And we also have the trainer, by the way, in this webinar. So we're taking notes. We want to develop a training in this area. We're already working on it. And then we contact you, when this training is ready. It's going to be very, very shortly. We're going to organize this training. Well, I have to say this. It's very important for you to. One of the criteria for participating in that training is that you must have attended this particular webinar, and this is well attended, as I can see, across the African Caribbean. So I think Pacific as well, I guess. So, but we're looking forward to having you in the collective training. And another requirements, requisites, I think Dr. Kedera will mention it. We are trying to see that you should have also sent to us the quality. If you have anything in your organization, then the competent authority, the quality policies, which we collate at the end of the day to be able to prepare and to meet your need for that particular training. So we're looking forward to joining the training once we launch the invitation to you and meet the requirement. Thank you very much. Thank you, Dr. Kedera.
Thank you.
Dr. Kedera? There was a question also. Would you mind sharing
the first
again
question, please?
your
No,
just
I'm going to the first question.
to share again the screen with the PowerPoint with the process of the webinar and then the collective training. That was a question also.
Yeah,
Sorry.
I'm going to do it. I'm going to do it shortly. The first question was can a section or a department within an organization initiate a QMS? Yes, it is possible. Because if within an organization you are thinking about how you will achieve your objectives and then demonstrate the effectiveness to the top management to get results, it is possible. The issue is there is, the convincing you need to do, the resources that you need to do the system. If you have them available, you can go ahead. It is not difficult. As colleague, this particular session, I think if some of you read the invite, it was clearly addressing the directors. We know some of them. We know some of the heads, respective heads. And we try to make it short, maximum 2 hours, because we know they're busy. Ideally, we would just have said we are having this training and it starts from wherever it is and the training goes on. Because that way we then lose value. And that's why we try to do shorter sessions to introduce the training to see whether the senior management of the competent authorities can find time to attend so that they understand and appreciate the value of the time the officers would spend in the follow-up trainings to achieve some tangible results towards what they're doing. So it is something that is continuous. It is, you guys know your countries very well. You know, if we want to progress with your directors and the rest, what needs to be done, and therefore we'll be relying on you to get the information. So it's learning in progress, I would say. I've been asked to share the last slide, and I think I did explain it. Yes, this one. Are you all seeing it?
Yes, we see it. Thank you.
This is where we are, the introductory webinar on what it is. You can see we were targeting directors and managers, and there was no prerequisite in terms of the participation. This was to actually sell the idea to the top management. Remember, we've said we need ownership at that particular level. This is going to be followed by a collective training where we are talking about at least 2 people from each of the countries. And I've had the case of Botswana. Yes, give us a proposal if there's going to be more. But we, of course, will be looking at the numbers. And here we're talking about, at least as you nominate the people, we want to know whether you've got a quality policy statement that can now be used and worked on as we prepare for the training. And then at that time, we need a quality manager to have been appointed and a deputy. Our proposal is that one of the people being trained is supposed to be the person who will be designated as the quality manager. But we do not control what you do within your countries. You have better decisions in terms of what happens in the countries. And these nominations are expected before 30th June. Today is, which date? Is it 10th?
It's so 12.
12th. I was trying to give you more, to say you've got more time. 12th, so you've got 18 more days to give us the nominee. But please don't wait until 31st or until we've sent a reminder. Then this would be followed up by a specific support to those who would request based on the training. And also during the training, I think there will be information that will indicate where more training, where people can actually get access to more information about QMS. Okay.
Dr. Kedera, can I jump in and
yes,
say something? So we had the similar session for your colleagues speaking French, and there was a question raised about the the policy, the document that is requested to participate to the collective training. It doesn't need to be official. It doesn't need to be signed by the ministry or anything like that. It's just a draft. Okay, so some people were saying yes, but it has to be signed by my ministry. Not for this, in fact. It's just a draft document.
Yes, thank you. There's a comment from Nya Lua Kapu. I would like to recommend frequent or quarterly training for capacity building of NPPOs. Yes, we are doing very many of these trainings. Sometimes we get discouraged by the response that we get. You advertise, you follow up, and very little comes in. Nakato, there's not a question from Uganda. Somebody from Botswana, management buy-in and leadership commitment. Awareness training for top managers, I think, is something that is crucial. And of course, there's something that we propose that in Botswana in collaboration with SADC. That's good. It's good to hear this because it is important. And one of the things that I always say to a majority of you, some of you have heard that statement, the value proposition of plant health and food safety in our countries is still very low. In actual fact, plant health professionals, food safety professionals are only recognized when there's a crisis. It is a narrative we need to change, such that even as top managers in our system or in our institution see the value of what we are doing. When we talk about a plant pest, so what? In fact, sometimes you may be asked whether plants really suffer from, are really infected by pests. Food poisoning, when it has killed a few people, is when your food safety gets attention. But then as soon as the issue is over, food safety goes back to where it belongs. So let's keep up it is only us who know the value of plant health, who know the value of food safety, that we can raise the profile of these professions within our ministries. Now, so there's a request for the presentation and the recording.
Yeah, I've put in the chat that if you had not registered to the webinar, I don't have your email addresses. So if you want to receive the PowerPoint and other documents, that please put in the chat your name, organization, and email address. Thank you. If you have registered, no problem. But if you have just used the link that I've sent this morning, then I don't have your email addresses. Thank you.
Thank you. I see no further questions or comments, and I would like to sincerely thank you for attending and participating. We look forward to receiving some of you during the oncoming training, and we look at all our countries establishing a quality management system. Thank you very much.